Hi, the Trendelenburg test is very confusing to many students. But if you understand the logic right, varicose veins becomes a very easy long case in your exams. Welcome to Surgically Speaking. Come with me, I'll explain how. And remember, this is what the examiner is expecting from you. See, this gentleman has come to me with the complaints of dilated veins. He has got dilated veins over the leg. These veins, if you notice, they are dilated, tortuous, subcutaneous veins. Dilated, tortuous, subcutaneous veins he has, which is extending from the malleolus region on the medial side, on the anterior medial side. It is crossing the knee joint region and it is crossing the mid thigh and it is going up to the saphenofemoral junction here. So that is the extent of these varicose veins. And what I want you to notice is, in some places there are prominent areas. These are called the blowouts. These are called the blowouts. See here, if you see, this is somewhere in the mid thigh region, there is this prominent bulge. It is a blowout. If you palpate there, if you palpate at the region of the if you palpate at the region of this blowout, I am able to feel a button-like defect in the deep fascia, and that is called the Figan's test. Okay, that is Figan's test. And now I am going to demonstrate two tests to you. One is Brodie Trendelenburg test 1, another is Brodie Trendelenburg test 2. Okay. Okay. So now we are going to perform the Brodie Trendelenburg test 1. In the examination they'll ask you how to perform the test 1. What you should say is, step 1, elevate the limb. Elevate the limb. The next thing you should do is exsanguinate the veins. You should exsanguinate the veins. Exsanguination of the veins you should do. Get the veins empty. Okay. See, these veins are still prominent here. So empty the veins nicely. That is the step 2. The step 3. Sister, come here. Hold this leg. Give me the tourniquet. Now, what I am going to do is, I am tying a tourniquet at the saphenofemoral junction. So we are tying a tourniquet at the saphenofemoral junction. Tie the tourniquet, and then now you ask the patient to stand up. That is the step 3. Now I have made the patient stand. The tourniquet is in situ. I am going to release this tourniquet. And what you observe is, observe for rapid filling in the above downwards direction. If there is rapid filling in the above downwards direction, you would have noticed that this vein is filling up so fast. That means the test 1 is positive, which indicates that there is saphenofemoral junction incompetence. So that is test 1. Immediately after release of the tourniquet, if there is rapid filling of the blood in the veins in the above downwards direction, that is test 1 positive. The test 2 is, you don't release the tourniquet and then you just watch for filling of the veins in the below upwards direction. If the veins get filled in the below upwards direction, even with the tourniquet in situ, that is test 2 positive, Brodie Trendelenburg test 2 positive, which indicates perforator incompetence. Okay, so that is Brodie Trendelenburg test 1 and test 2. The other tests I will demonstrate in the other video. Thank you.